Hello, I'm Dr. Hammond, and this is Kramer, and we're from the Clements Ferry Veterinary Clinic, and today we would like to help you better understand heartworm disease in dogs. My technician, Kristen, will be helping by asking some questions, and I'll provide the answer to help you better understand the signs, prevention, and treatment of canine heartworm disease.
Dr. Hammond, what is heartworm disease and how can it affect my dog?
Heartworm disease is a condition in which foot-long spaghetti-like worms accumulate inside the hearts of dogs. This condition then results in the heart no longer being able to effectively pump blood throughout the body, heartworm disease, and ultimately, if left untreated, it is fatal.
And how would my dog catch heartworm?
Heartworm is spread through mosquito bites, very similar to malaria disease in humans. So it just takes a single mosquito bite for a microscopic baby worm to swim out the nose of the mosquito and into the body of the dog. It usually swims around for about 3 months, where it then makes its way to the heart and grows over the next 3 months into an adult heartworm. The adult heartworms then give birth to live microscopic baby heartworms that start circulating in the bloodstream of dogs. Some of these heartworm babies will be sucked out through the nose of a mosquito and spread to other dogs through the next mosquito bites. But some of them will make their way back to the dog's heart, where they will lead to a worsening infection of heartworm disease, and it becomes kind of a snowball effect of baby worms becoming adult worms until the heart fills up.
And can dog heartworm be prevented?
Luckily, with modern science and medicine, heartworm is very easily prevented these days. You can give your dog a once-monthly oral tablet, such as HeartGuard, Interceptor, things like that. Also, the new Simparica Trio is an option for a monthly pill that easily protects against heartworm by killing any of the baby heartworms that have found their way inside your dog. Other options are the topicals like Revolution that you just apply to the back of the dog's neck and it's absorbed. That's a good option for dogs who don't like medicated treats. And then another option that I really like is the ProHeart injection. This is a fluid that is made of slow release granules. It's deposited under the skin of your dog and is slowly released throughout the course of either 6 months or a year to keep your dog constantly protected from those baby heartworms.
So what are the signs in my dog that would indicate they may have heartworm?
Great question. So one of the first signs you'll notice in a dog is coughing. The coughing occurs because those long spaghetti-like worms start kind of poking out of the ends of the heart and into the lung fields. So when that happens, think of it like tickling the lungs. The dogs start coughing. It's almost like they're trying to cough something up, but nothing comes out. You might notice then next a little bit of lethargy. Perhaps they're not as playful or as active as they were before and have a little bit of exercise intolerance, meaning that they just can't seem to catch their breath and they get worn out a little earlier than they used to.
And what are some middle to late stage symptoms of heartworm?
So late stage symptoms of heartworm disease will be very similar to your heart failure symptoms. You'll notice the dog coughing. It almost sounds a little bit more wet at this point because fluid can accumulate in the lungs. We call this a right-sided heart failure as well because the heartworms make it hard for the blood to come back to the heart from the rest of the body, back to the right side of the heart before it goes to the lungs. So you typically will see an increase in fluid in the dog's abdomen. So they kind of get like a pot-bellied appearance, extra fluid in the abdomen. Their liver might be bigger. You might be able to tell or notice this. A veterinarian definitely can. And then again, worsening of a cough, lethargy, exercise intolerance. Typically you'll see weight loss because these dogs don't feel good and they're not going to be eating. And so it very closely mimics heart failure.
And if my dog does have heartworm, what can be done to stabilize my dog's heartworm disease?
So the earlier we catch heartworm, the better, because the earlier the heartworm is found, the less severe it is and the easier it is to treat. If we detect that your dog is positive for heartworm disease, we will just start treatment based on where they're at in their stage. This may include having to stabilize their heart failure, but hopefully if we've caught it early enough, we can actually treat and kill the adult heartworms with a series of 3 injections. It is kind of a long treatment and unfortunately it is a little bit painful and uncomfortable for dogs, so it's always better to prevent it than have to treat it.
And how soon should I bring in my dog to see a veterinarian for heartworm prevention?
Great question. The sooner the better. We can safely begin heartworm prevention in puppies as early as 8 weeks old. So if your new puppy is 8 weeks or even a few weeks early, come in, pick up the medication, start it as soon as they're 8 weeks so we can keep them protected as long as possible. But it's never too late to start your dog on heartworm prevention no matter how old they are.
And how will a veterinarian diagnose if my dog does have heartworm?
Heartworm is very easily diagnosed with a simple blood test. It just takes a few drops of your dog's blood to check for the presence of heartworm antigen in their bloodstream.
Why is early detection and diagnosis of heartworm so important?
As I mentioned before, the earlier you diagnose heartworm, the easier it is to treat. When those worms start to stretch out and mess with the structures of the heart, that damage is irreversible. So you want to catch heartworm disease before it causes any irreparable damage to your dog's heart and lungs.
Thank you very much, Dr. Hammond.
It was my pleasure. I hope Kramer and I were I hope Kramer and I were better able to help you understand heartworm today. Good job, Kramer.